For 20 years, I have been running a non-profit organisation for a skin condition called Lichen Sclerosus, so I'm the founder of that non-profit. I'm interested in doctors who are thinking outside the box, who are coming up with new treatments that may be helpful to people who suffer from lichen sclerosus and help their quality of life, help them to have better sex lives. During my conversations with Dr. Ronalds, he told me about Dr. Sherif Wakil, who is the only doctor in Europe at the moment to be performing the O-Shot. And I made contact with Dr. Wakil because I'm interested in anything new that will help patients. And we had a meeting and some discussions, and we're trying to work together in order to help patients with lichen sclerosus, to help them support their skin and their condition and to get them back to a good quality of life.
Hi, Fabi, how are you? Lovely to see you.
Good to see you.
Good to see you too. Have a seat, please.
I am here today with Dr. Wakil in order to try the O-Shot, to see how it helps my own condition and to see what information I can share with others about how it can help them as well. One of the things that emerges when talking to patients is that they feel very happy and confident and relaxed with the doctor who's going to be performing any kind of procedure. My experience of Dr. Wakil is that he is passionately concerned for the welfare of people with lichen sclerosus, that he has a very deep commitment to wanting to help them become well. He is a very charming, pleasant person. He explains everything carefully. You feel very cared for, and you can ask any questions, and he's very happy to help.
Fabia, any questions for me?
No, I'm good.
Fantastic. So if you don't mind, just go inside the room, get prepared. I'll prepare everything here. Then you come out and go ahead for the procedure. Yeah? Excellent. Very simple. First, we apply some numbing cream on the patient, which is a very special cream that they can use in the vagina. Then I take some blood from the patient. I centrifuge it into a very special centrifuge that I actually brought with me from the States. It's the same centrifuge that Dr. Charles Ronalds, the inventor of the O-Shot, used. I could actually take 60 ml of blood from the patient and centrifuge it to 10 ml of PRP. After achieving the PRP, the patient is probably very numb. Then we start the procedure and we inject in a special way inside the vagina as well as the clitoris.
Every effort was made by Dr. Sherif and by his more than excellent nurse to make sure I was comfortable, and everything was explained to me as it was happening, and I was able to relax, and there was some minor discomfort, but that passed very quickly. So I was a bit nervous and I was a bit tense, but actually now I feel okay. It's now 2 weeks since I had the treatment, the O-Shot treatment with Dr. Wakil, and I've been very surprised by the results, very pleasantly surprised. I felt that the treatment was very simple, that it wasn't invasive at all. It was easy to do, and the results are seen very quickly. So within a few days, I was in no discomfort, and my particular area of concern was improving. The colour of the skin was improving. As the 2 weeks have gone on, I have noticed a definite upturn in my personal desires. There are some very pleasant feelings, which is very nice to have. I've also found that the little bit of trouble with incontinence I was having is now getting much better. In addition, I tried intimate relationships with my partner, and that was very successful as well. So I'm really very pleased and delighted really to have this improvement in my own case. I want to say that I'm grateful to Dr. Wakil for bringing this treatment into the UK and for making it available, because people really do need to enhance their quality of life. And it's nice if we can have the treatment in this country, that people don't have to go abroad. And I really want to thank Dr. Sherif for that, and hope that anybody thinking about this treatment will get in touch and try it.